So we're back again for another episode of our wellness series here at Heart Times. And today I'm very excited to introduce to you Christine Grimes, who has practiced massage therapy in Canada for about 8 years. Is that right? Yeah,
Yes.
and is now practicing in Washington on a little island called Whidbey Island. Is that what it's called?
Well, I technically am not practicing now because I'm immigrating, so I can't work yet. But yes,
Okay.
I'm on
So,
Whidbey Island.
yeah, so you've done so much just amazing work in the field of massage therapy and seem to really have an interest in that connection between mental health and physical health and kind of the whole health spectrum. So that's really why I wanted to have you here, was to talk a little bit about that connection. But first, to start off with, thank you for being here. And yeah, and I was curious how you got into massage therapy.
So, okay. So I actually originally wanted to be a therapist. Um, and so after art school, so I went to art school and I realized that I was really interested in healing. And I started working in the downtown east side in Vancouver as a mental health worker.
Yeah.
And uh, to gain experience, but also it was part of the requirement for applying to the master's degree. But while I was there, I started to notice how talk therapy wasn't always appropriate for the people that lived there.
Right.
And there were a group of massage therapists that came in to this woman's recovery center that I worked at. And every week, and the people that were staying there recovering from drug and alcohol abuse. They all really looked forward to their massage therapy. And that
Mm.
night, everything was so calm. And I really started to notice the power of touch to get to people through. It's like a way of accessing more of the subconscious layers of healing, because I think sometimes when we're talking we're engaged in like a more literal or in the story of our trauma instead of feeling it. And I think expressive therapies are similar, right, where you're
Yeah.
getting into the body, getting into the more of like a subconscious relationship with your issues.
Mhm.
um, but anyway, I found that very inspiring to see how touch could be so powerful for
Mhm.
people that um, often never experienced it, um, at least at that time in their lives, and how important it was for them. And yeah, I found that.
That's really interesting. Yeah. And it's certainly very similar to expressive arts therapy and other ways of healing where it's working somatically with the body. So and really just that connection to your body and to the earth and getting a little bit out of our heads, which I feel like in Western society we really get stuck up here, and have quite a big disconnect between like our head and our thinking brain and our heart and our bodies, right? So anyways, that's very interesting. And I mean, what I was particularly concerned about and thinking about meeting together tonight was, um, you know, do you see how the impact of massage therapy, um, how it has an impact, I guess, on people, not just with physical ailments, like let's say someone, you know, having a bad shoulder or having gone through an accident or something, a car accident, versus maybe going through a really stressful time in their life. Or I'm thinking right now, even during like the COVID pandemic, that it's really hard for single people in particular to even get physical touch. And so I'm curious if you've seen in your practice how massage therapy can help those aspects as well.
Yeah, I think a lot of people will manifest stress in their bodies as pain anyway. So sometimes you'll have people coming in for pain that will then access the more emotional or like mental health aspects of their pain. There are definitely people who come in and it's more like maintenance. I don't think that you can unwind a mental health issue, but you can help decrease anxiety, improve
Mhm.
sleep, decrease pain. And then there's also the interpersonal connection and touch that I think works on a different level. I haven't done that research personally, reading articles about that, but I have definitely read about the the clinically significant effects of massage for anxiety,
Mhm.
pain, and depression. So, so that's definitely true. In
Yeah.
terms of my own personal practice, working with clients, I found that um, I would say people don't necessarily want to talk about that as one of their main issues for coming in. And I don't know if that's because it's still stigmatized, but we do, if you see that someone is on medication for depression, well, I will ask them about it.
Mhm. Right.
But within the massage therapy scope of practice, the mental health aspect is, it's out of our scope of practice. So I would do more things like encourage people to go and see a therapist,
Right. Yeah.
which I've done a lot of, referred a lot of my clients to therapy. That has been very helpful. I think partially because I know good therapists that I could refer them to, which is really important to know who you're referring to. Um, and it's been wonderful to see the effects of that therapy in their lives. So as a complementary um,
Kind of tool.
yeah, as a complementary tool, I think that that massage is great, and it can get people who might not be willing to undergo talk therapy or like psychotherapy. It
Mm.
can be a gateway to it, I think.
Yeah.
Once they start learning, because within a session you learn how to regulate your nervous system more, because the
Mhm.
massage is not, it's not a passive thing. When you're massaging someone, it's like you're educating the muscles about the tension that they're holding, because oftentimes people are not even aware of the fact that they're like holding their shoulders
Yeah. Yeah.
up here and they're full of knots, so when you remind the body, hey, like, you don't need to hold on to that, you can just let that go.
Mhm.
They start to breathe into it and then they realize, oh, like,
Mhm.
this is what it feels like to be relaxed, and they start to see
Yeah.
the difference and become aware of the fact that there may be issues that they haven't um, really processed yet, because we're not always aware of our anxiety or our depression. Sometimes we need that feedback.
Yeah, and you bring up such excellent points because, first of all, you're right, you can't tease apart all of it. So there's, mental health, physical health, it's all intertwined in our experiences, right, throughout our lives and what we've gone through and what we are going through and having to live through. So it's you don't necessarily tease it apart, but I do think you're saying a lot of what even in therapy and in counseling, what we do, which is to bring an awareness of, um, you know, oh, okay, so there's a lot of tension here, or this doesn't feel right in my life, or I need to pay a little bit more attention to this. And even though it's done in a body centered way, I mean, that's massage therapy, it still can bring up those other layers of whatever people might be going through. And in that way can act really nicely and conjointly with therapy, um, or counseling, right? And so, yeah, it's very interesting to hear that. Um, what would you say is the thing that is the most challenging about massage therapy?
I would say when people come in saying that they're like perfect, they don't have any issues, and they just want a relaxation massage, I find that the most difficult because I want to be working on problems and helping people and working as a team towards a healthcare goal with that person. So if somebody just wants a massage, I usually try to refer them to a spa, but there it you know
Yeah.
there
Yeah.
are occasions where you'll have someone who comes in and they really do have issues, and you can find them and point them out, and then develop a treatment plan from there with that person. But
Yeah.
yeah, I mean, I feel like if people don't want to heal, or they feel like they're perfectly fine, they don't need anything, um, then I don't see what my role is,
Yeah.
right?
That's challenging. And I know we face that too as counselors and as social workers and therapists, because people sometimes don't know really why they're coming to you, but they just decide to book an appointment and there's some sort of inkling, or maybe there is an issue on their mind, but they just don't voice it. And one of the things that I personally love about expressive arts therapy is how it kind of gets all of those issues and baggage and stuff that you don't really want to talk about or mention out into this like third thing that's, out there that you start working on, whatever it might be. It doesn't have to be some masterpiece or something like Michelangelo, but it just something that's out there that then when you point to it and you start noticing it, it feels a little bit less close to home, right? And you're just able to distance from it in a different way.
Mhm.
um so I know I personally have found massage therapy very helpful in my own journey, just as a human being and as a counselor, because it does really connect you with your body, and it's an interesting way of connecting with another human being too, because especially when you begin, you don't know this person, and it's pretty kind of an intimate kind of setting in many ways, right? And yet, so there's so much opportunity for building trust and building that sense of like connection and human touch and awareness of your body and all of that, right? So it's I find it a very effective tool, especially to help people who do have maybe a history of trauma or things that make them even more disconnected from their bodies than
Yeah.
all of us.
And honestly, yeah, the being trauma, I mean, they have this phrase trauma informed. And I think it's actually really helpful because when you go to a therapist and you're stressed out and you're going through something, you want to go to someone who's going to be compassionate towards you and not look at you weird and be like, well, I don't treat anxiety, I'm a massage therapist or something like that. Like you can massage can be effective for so many different things, and like that level of compassion is just so necessary, that to empathize with people, not to pity them, of course, but to really like see that person and be there for them. That's part of our job. So yeah, definitely, I think as a therapist, it's so crucial to not just think of it as a body, but to look at the whole person and really
Mhm.
really just make space. Um, you're not probing into their lives. You're not like, oh, and oh, how do you feel about your mother? Is your mother in your shoulder right now? Like
Yeah.
some people will do that. They'll like use some, I don't know, it's like there's different, maybe unqualified theories out there about like, oh, grief sits in your hips, something like that. But
Yeah.
that's not evidence based. So I try to avoid that kind of stuff, because I think if someone is going through something, that kind of information can be, like, you're in a position of power, that kind of information can be confusing to them.
Yeah,
So
good
it's good
point.
to just stick to what is evidence based, and really be open minded and just supportive, and be more of like a listener, and
Mhm.
be able to identify when someone might need a referral
Yeah.
to a counselor.
Yeah, that's very good points for sure. Why would you say it's important for people to consider massage therapy as part of their, health and wellness?
Um, So I think it's interesting. There are some people who are very skeptical, and they are referred, or it's like, oh, I had this one client who had bad whiplash from a bicycle injury, bicycle accident. And he, I'm pretty sure it was his granddaughter or his daughter that urged him to come in.
Right.
He was just, he was very skeptical at first, but then he was so grateful for it after, in the end. Like, I don't know, it's just really neat to see how some people can be kind of um closed off or cagey about it, and then once they see that it's actually working, and you have a real treatment goal, it's evidence based, that you're really taking care of that person and creating change in their body. And massage is much more effective for older people. I read this interesting study recently that compared, just as part of the study, they noticed that older people had more clinically significant results.
Hmm,
Um, so it's like
interesting.
60% of the 68% of the people, I don't know, maybe don't quote me on the exact percentages,
No,
but
yeah.
a
More
significant
people.
a
More people in
significant
have
amount
it.
of people, yeah, like the older people were the more benefit they received from massage, which I
Yeah.
thought was really interesting.
Yeah.
Um, but yeah, I don't know, I feel like there are some people, like, you do have to have some kind of open-mindedness, or enjoy massage, enjoy touch. I think that's just the precursor to getting the benefits of massage. So if being touched makes you more anxious or more rigid, you might not get as much of a benefit from it.
Mhm. Yeah.
Uh, but
And
yeah, I think on many levels, just like as a general maintenance, I feel like massage is really important. As we get older, our bodies start to change. We have habitual patterns of movement that get stuck in our bodies, and it can really help to reset um, the nervous system to like remember what relaxation feels like, remember alignment. I
yeah.
mean, I think that exercise and yoga, you need to be doing all of those physical activities as well. But even if you're taking great care of yourself, massage is still, I think, very helpful.
Yeah. And I do find that, generally speaking, this is a generalization, but maybe because of the cultural expectations or ideas for men, that they might be a little bit more hesitant. I know I've had some friends and so on in my life who have been like, what, massage therapy? And then they've gone into it, and they're like, my age, in their 30s and 40s, and it's a new experience, and suddenly they're like, this is really good and this feels good and I am seeing a bit of an improvement. Or even just that idea of maintenance of health, especially as people work out and have the sore muscles or just ways of moving that get a bit stuck. And once again, it's so similar to counseling and therapy that, people are a bit hesitant at the beginning. And then with a good, thorough, clear treatment plan, it can really move in a direction that's surprising and that helps people out in a, time in their life, right? Whatever that might look like. Um, I'm very curious if you painted that in the background. The
I did, yeah, it's one of I'm working on
Wow,
that.
that's amazing.
Yeah.
Yeah,
Well,
yeah,
it's hard to see, but thank you.
yeah. I love the color of it.
Yeah, it's just the underpainting right now, but it'll be I might do one very similar to it. Um and then I've got like I think I probably showed you my horse one, but I've got a
Yeah,
sky one that I'm working on now too. So
nice. It's beautiful. Well, I have some beach photos in the background myself. You
oh
can't totally see them, but yeah, and it's just so nice and calming, and I like the use of color. So, anyways, I had to ask.
oh thanks.
Yeah. Um, I am just so grateful for being able to have this conversation tonight with you, Christine. I wonder if there's anything else you wanted to mention.
I feel like I didn't answer that question very well. The like you asked me what I think why people should get massage or why I think it's helpful.
Mhm.
And I guess my point was like I don't know. I guess I feel like there are maybe older people are not as open to it, like my mom's generation, the
Mhm.
baby boomers.
Mhm.
And yet, massage is probably the most effective for that age group. Um, it has been shown to be clinically uh, to give clinically significant results um, for lowering disability scores for people, for arthritis, anxiety, sleep issues, and obviously I think it feels really good.
Mhm.
And so there's a
Does.
pleasure element to it, but that really is not all of it. It's just one of the more enticing parts. So there are real clinical benefits to it. And I feel like some of the older clients that I have, they think of it, they're more like a luxury or they're pampering
Mhm.
themselves.
Yep, I think there is that idea. And I even think as a younger person, I often felt that way until I was able to get benefits and have a job that gave me benefits. And it was like, why would I, like once a year maybe, or maybe twice a year, I'd be like, sure, let's go to a massage therapist. So that is one of the reasons why I ask. At Heart Times, we see a wide range of people, like young children as well as, into the 80s if they want to do some expressive arts therapy. But I think in many different stages, people are a bit like, what's with massage therapy and how can it really help?
Yeah. And, I find for myself and, for my clients, if you have some pain, say you tweak your neck or, I don't know, you just develop some strange pain in your body. Massage therapy is really effective at just smoothing that out. And I'll see some of my clients will come in and they will have had pain for years and massage can help get rid of it. So it's
Yeah.
unique. You can go to physiotherapy, and I think a lot of physiotherapists are moving more into massage, and they can be very effective. Absolutely, and I do refer to physiotherapists, but the massage itself, I think, can be so healing for the tissues and for the nervous system to
Yeah.
become
Recalibrate.
yes.
Recalibrate, right? Yeah. Yeah. No, I think you did answer the question, Christine. I
Oh,
think I
There's
think
just so many reasons to get
there's so many reasons, right? I mean, and there's so many reasons why people see massage therapists, but I think you're really speaking to how there's all different levels of, like, you know, the muscles and the tissues and the patterns in our bodies, and helping to recalibrate the nervous system, and really just release some of the tension and the stress and things that we aren't even picking up on in ordinary life. And these are all really things that help contribute to a life that we're thriving in, right? Which is a huge part of what we're talking about in this series. So yeah, I really appreciate you being here. And yeah, just thank you so much.
Thank you.
And
Well, I'm happy that you're doing this, and I think it's really exciting. And I look forward to seeing your series.
yes, thank you. So have a great night, Christine. And maybe one of these days I can hear you play the cello.
Oh, I'm not very good, but sure.
That would be fun. All right. Bye for now.